Okay, case 26. Ah, fantastic example.
So here we have this exophytic papillated dome-shaped plaque that has this amazing level of almost psoriasiform hyperplasia. However, you have these pale bulbs at the end of dermal papillae, some of which come to tapered point. I would go to higher power and see what type of cells at the end of these tapered points. Already in my mind, I'm thinking something that looks a little warty.
Yep.
And when I get a little closer here, it looks as if there are some foamy, lipid-laden histiocytes.
Good. Yes.
And so I would Verruciform xanthoma.
Very good. Yeah, Verruciform xanthoma. And really, with practice, the low power appearance is pretty distinct for these. It's papillomatous, verrucous, warty-looking surface with a bright pink keratin, usually without a granular layer, usually with a lot of neutrophils. One of my friends taught me it looks like a wart on fire. And I thought that was a pretty cool way to say it, that it's warty and then it's like bright red flames of keratin on the top. I liked your point, pointing out that it has some overlap with the pattern of psoriasis a little bit, right? Because of the loss of the granular layer, the parakeratosis, the neutrophils, the long reedy. So it does have this kind of overlapping psoriasiform sort of feel, but is way more papillomatous. And then when you go closer, the classic finding is that you'll see foamy histiocytes in the dermal papillae. So it's really, I used to say nothing else really looks like this, but I have one time seen a case of actual verrucous carcinoma, because verrucous carcinoma can have some similarities in the corneal pattern. I did see a case that was a superficial biopsy that I thought was going to be Verruciform xanthoma, and then when they excised the whole lesion, it turned out it was actually verrucous carcinoma. So I would not have, here I have no concern at all about verrucous carcinoma, but in that one case on a partial biopsy, it did trick me and made me think of Verruciform xanthoma, and only with the clinical being that it was so much larger and then them needing to excise it, then we were able to see that, oh, actually, it was actually Verruciform, or verrucous carcinoma in that case. But here, this is a classic Verruciform xanthoma, and these are not associated with any lipid abnormalities. The thought is that this is kind of a degenerative type of foamy histiocyte accumulation. They can occur in like oral mucosa, which I think is where this case might be coming from, and also in the anogenital skin. And I've rarely seen them like on the extremity or other sites, but usually either oral mucosa or anogenital skin is the most common sites to see them.